healthcare is too darn hard and too darn big for any one entity to do it on their own. So I'm a big believer in the power of ecosystems done right. One of the big bets that we're making is really building out these ecosystems.
Welcome to Startup Health TV, where we celebrate the entrepreneurs and the innovators who are transforming health. I'm Logan Plaster, here with Rasu Shrestha, the Chief Innovation and Commercialization Officer at Advocate Health. Did I get that right?
You got it right.
All right.
Excellent.
Rasu, great to have you.
Yeah, thank you, Logan.
I know Advocate Health, huge health system, covers a lot of the Midwest, the Southeast, I think. Huge patient population, big catchment area. Tell me about, give us a sense of what Advocate Health stands for today and kind of the work that you do.
Yeah, no, absolutely. So real pleasure to have this conversation here, really. So Advocate Health in its current form is sort of new, right? And a lot of people don't really know about Advocate Health in its current form. Okay. We're really a coming together of a number of different health systems. So in its simplest way, in the Southeast, it was Atrium Health. Okay. Right. So Atrium Health in the Southeast, coming together with Advocate Aurora Healthcare in the Midwest to form Advocate Health. Part of that is also the Wake Forest University School of Medicine. So that's part of the Advocate Health family, right? And a number of sort of specific health systems in both the regions, really. Again, Atrium Health and Advocate Aurora Healthcare, with the Wake Forest University School of Medicine as our academic core for Advocate Health.
So making it, I'm guessing, one of the biggest health systems in the country.
Yeah, so we've grown quite a bit in the last several years. So Atrium Health, when I joined 6 years ago, we're about $7 billion annual revenue, which is, pretty big onto itself. And, we pulled together a strategy that we called Impact 2025. My role at that point was I was the Chief Strategy and Transformation Officer. And it was a lot of fun putting that plan together, right? And one of the 9 strategic priorities for us was growth, scale, and influence. So we didn't call it our growth plan. We called it our growth, scale, and influence. It's growth for the sake of scale, scale for the sake of influence.
Okay. I'm sure 2025 seemed a lot further away than
it did.
It does now.
Yeah, it did. It sure did. But a lot has happened in 5 years, right? If you think about not just the global pandemic that we've lived through, but also all the different dynamics, the technological advancements.
It's been a big 5 years.
It's been a big 5 years. So, and then the growth for us, right? So from the $7 billion health system to now a $33 billion health system, we are one of the largest health systems in the country.
Okay.
The 4th largest health system, really, if you're putting a pin to it.
Yeah. So chief innovation, also commercialization, but the innovation side, talk to me about what's the ethos of your department? How do you think about innovation at Advocate?
So innovation really is a culture, right? It's a way of living. It's a way of thinking. It's a way of doing. It's a way of caring. It's a way of teaching. It's a way of collaborating, right? It really is a culture. And when you think about Advocate Health in sort of the platform that we are now as one of the larger health systems in the country, we're headquartered out of Charlotte, North Carolina, but really spread across all the way from Milwaukee to Macon, Georgia, right? And that's a big span across the board. And, I'm a big believer. I'm a radiologist by background, trained in informatics and business. And I've been doing this now for the last 25 years. And, and we've seen it. We've seen it in the startups that you guys nurture and curate and accelerate. We're seeing it in the industry across the board, that healthcare is hard, right? And healthcare is too darn hard and too darn big for any one entity to do it on their own. So I'm a big believer in the power of ecosystems done right. And so one of the big bets that we're making is really building out these ecosystems. We have our innovation quarter, our big innovation district in Winston-Salem in North Carolina. In Charlotte, we're building out what we're calling the Pearl, our innovation district.
I've heard of this.
Yeah. So Charlotte is one of the fastest growing cities in North America. It is the 2nd largest financial hub in the country. And the Pearl will really be the crowning jewel in the Queen City that is Charlotte. So super excited about that. Part of that will be the new medical schools, Charlotte's first 4-year medical school, what will arguably be the most innovative med school in the country.
Wow. Okay.
Will be the anchor. And then a super magnet that is ERCAD North America. It's a destination, robotics, experiential learning, surgical simulation. We'll talk a little bit more about that. But really building out this ecosystem. And then similarly, as we think about, everything from Georgia all the way to, Chicago and Illinois and the Wisconsin market, we're focusing on innovations in health equity. We're focusing on innovations in population health. We're focusing on innovations in health and wellness. So lots of amazing things.
Yeah. How do you decide where to focus? Obviously, you have such a broad, potential influence. In your department, obviously, you have to pick projects. You have to say, like, whether it's the Pearl, like, this is where we're going to focus. You could just put all your energy into, like, broadband, like just making sure people have access to, digital services. So how do you decide where to focus?
So I'm a big believer that, you have to really inoculate yourself against what I call the shiny object syndrome. There should be an ICD-10 code for the shiny object syndrome. And we've created an entire structure around how we inoculate ourselves against the shiny object syndrome and tap into the core ethos of who we are as this living lab of advocate health, right? One of the largest academic learning health system. We do a lot of research. We do a lot of academia. So let's base the strongest bets that we're making on the foundations of that academic and scientific rigor, right? And then prioritize, right? So as we think about those priorities, right, health equity is a big priority for us. Part of our mission is for all. We're serving for all, not just the few.
And you're in some rural communities. You're in some really low income communities with a lot of challenges.
Absolutely, right. And when you think about us as a $30+ billion health system, 18.6% of our net operating revenue is reinvested back into community benefits and uncompensated and free care. That's amazing. That's $6 billion last year. Wow, it'll be close to $7 billion this year. So that for all mission and the innovations around health equity and social impact is a big thing. We're also prioritizing robotics and experiential learning and surgical simulation and AI. That's a big area of focus. So ERCAT North America will be the destination center around that. Super excited about that. I'm also excited about the sustainability and climate change. And
yeah, how are you weaving that into your priorities?
So, when we pulled together our last strategic plan, Impact 2025, we had sustainability as a core driver of the strategic plan. And now as we're thinking about the next 5-year strategic plan, it continues to be a big pivot point for us. And when we're thinking about a health system as large as ours, we believe that, planetary health and actual healthcare, human health, are really interrelated, right? So, and a startup health is all about moonshots. We think that there's an opportunity for an Earth shot.
Okay, I like that. I haven't heard that before.
Here we go. You heard it here first.
Yeah,
absolutely.
Did you coin that?
Well, yeah, our team coined it. Yeah.
So an Earth shot, your Earth shot, okay, we're saying, look, planetary health, human health, inextricably linked.
Absolutely.
We got to have it in the same conversation from day one.
Exactly right. And how do we come together, again, in that power of ecosystems done right? Because this is not just advocate health. This is not just any health tech company or any other organization. It's all of us together really committing to and making the right changes so that we can move the needle in a significant way forward.
What interests me about this, and I think find so fascinating, is the outsized impact that a health system can have in a town, in a smaller region, just as like a tech forward employer, as an anchor point for a community. I live in downtown Baltimore. The effect of Johns Hopkins being based in Baltimore can't be overestimated. And so every town that you're in, you are basically elevating every aspect of that town potentially.
That essentially is it. And the other thing that we're doing is we're then connecting all of these hubs of innovation, much like you have a network, an airline network, and you've got hub and spoke models. But the general idea behind this is every geography that these innovation ecosystems and districts and they're rooted in, take advantage of the opportunities in that particular city or a particular geography, but also of the challenges that exist there, right? And so we're really excited about, continuing to build up that ecosystem. And I know that's a core ethos of startup health as well.
Absolutely. Yeah, we've worked with 500 companies. It's been great to have you, Advocate, as a partner all these years. Obviously, we work with early stage folks. A lot of them were like, oh, how do I work with Advocate? How do I work with a big health system? What kinds of startups are you looking for? Whether it's a specific type of business or more generally, what would you like to see presented to you?
Yeah, so the specific type of startup that I'm looking for is a startup that is bound to be successful and with $1 billion exit and a whole lot of impact. Right? That's what I'm looking for. So if you can give me the list. No, but specifically, what I am looking for, what we are looking for, are startups that that have good leadership. I think that's important, right? It goes back to the people, the leadership. The technology has to be solid, right? And then it has to be a strong business model around it as well, right? How are you moving the needle? What's the economics?
Which of those three things to you pushes you over the edge, and which generally end up being kind of table stakes?
So I don't think there is a set formula. What I do look for is what I call the perfect imperfect. Okay? So think about us as a living lab of advocate health. We're not a venture capital group or a banker that's coming in and saying, all right, we're going to sign a check and, you better perform and here's the ROI that we expect and we're going to like flip it in X number of years. That's not who we are. That's not the value that we bring. Now, my team manages strategic investment fund for advocate health, right? So there's that, let's put the money where the mouth is kind of a construct, but we are looking for that perfect imperfect. So it could be the perfect leadership team, or close to perfect, right? Good tech stack. Maybe the product, needs some work. Well, we're the living lab, right? Let's co-create, let's co-develop, and let's take it to the next level, right? Let's scale it across advocate. Let's then take it through the right vehicles and scale this nationally and maybe even more broadly, right? So that construct of that perfect imperfect, I think, is really important. But it has to align to our priorities and the strengths that we bring, and it has to be complementary as well.
Yeah. Beyond the obvious, what are you looking for in a leader of a startup?
Yeah. So obviously a level of tenacity and grit and rigor is critical, right? That leader, and when I reflect back on the many startups that I've been involved in throughout my career and many that we've funded and grown in my career, I think the one quality of that leader is also the ability to connect. Yeah, you probably did. Right, the ability to connect with their teammates, the ability to connect with an investor, an ability to connect on the messaging behind the why, not just the how and the what. Right, I think that's really, really critical.
Yeah. Well, Rasu, it's been fascinating to hear your priorities. Advocate Health obviously has such a huge influence over the country as one of the top health systems. What are you most excited about for the next 6 to 12 months? Next milestones we should be looking for?
So I'm really excited about just, changing the mindset of healthcare overall. And one specific example of that is, I talk about how it's really important for us to broaden that aperture from patient-centered care to more person-centered care. So the patient is always in the center, right? I'm a clinician myself. The patient is always in the center, but we got to broaden that aperture to more of a person-centered care approach. And one specific example of this is really our bet in health at home and wellness. We started this program at the thick of the pandemic, our hospital at home program. We today have the largest hospital at home program in the country. Wow. So this has been 4.5 years plus, right? The thick of the pandemic is when we started this. 2.5 years ago, we signed a partnership with Best Buy Health, so we could scale this across advocate and nationally as well. And think about this, right? We're able to now give care to really critically ill patients in the comfort of their home and decrease the cost of care by 25%.
Wow.
And increase the experience scores multiple folds, and the quality scores are on par, if not better, than bricks and mortar facilities. Wow. And what started off as just, COVID and COVID presumptive patients, today we're treating over 150 different conditions in our hospital at home program. And that's just one end of the spectrum. And think about chronically ill patients that get discharged from the hospital with a remote patient monitoring, and we want them to be maintained in that circle of wellness and not fall into the circle of illness. And then you and I, the worried well, on the other end of that spectrum. So that health and wellness journey, when you broaden that aperture from patient-centered care to person-centered care, becomes not just a big motivator for the right models that we're pushing forward, it also becomes the right business model to sustain the trajectory of these innovative care models.
I love it. Well, I like the way you think. It's exciting to see where Advocate Health is today and where you're going to take it in the years to come. So thanks for stopping by.
Appreciate it. Good to meet you, Rasu. You too.